This lecture reviews Chapter 10 from the textbook. The chapter is written by Richard Fox and is entitled Lessons Learned, 30 Years of Applied Behavior Analysis in Treating Problem Behavior. Now, of course, a lot's happened in behavior analysis since this chapter has been written, but I would like you to approach this chapter with the consideration of systems. And when I talk about systems, I'm going to focus more on the systems within which we work. And that's not to say specifically behavior analysis, but more the organizational system within which we work. It's something that we haven't talked about perhaps at all or not a lot throughout the program, but I do want all of you to walk away with some general idea of the notion that the systems within which we work are amenable to the same behavioral principles as the individuals with whom we work. So if you are looking to change an individual's behavior, we apply the principles of behavior. If you're looking to change a system within an organization, we should utilize those same strategies, only on a larger scale. So this chapter sort of talks about that in a roundabout way, but I think it's interesting for anybody who's entering the early stages of their career. So, what is required for success, right? What is required for you to be successful at your job? Certainly, the knowledge and competencies required to be a good behavior analyst is one of them. But you also need support from from your supervisor, support from the organization within which you're working, or support from the system within which you work. So I would say the first thing required for success is that the organization or the administration embraces and supports applied behavior analysis. Now, my suspicion is many of you are working for an organization that really supports applied behavior analysis. You may be working for in-home or school consultation services, and the CEO or the directors of the agency within which you work may be behavior analysts. So, of course, they support behavior analysis. However, there are other organizations that the directors or the CEOs are not behavior analysts, and they may not have good knowledge of behavior analysis. As such, they may not fully support it, or they may not support it in a way that is necessary for it to be effective. So I think the take-home point here is that if you're looking for a fruitful, successful career in behavior analysis, you should be working for an agency that fully supports behavior analysis. So the most successful outcomes are produced within organizations that fully embrace ABA. Either the CEO or the director is a BCBA-D, a doctorate level behavior analyst, or a BCBA. So a few things to say there. Certainly, BCBAs can operate successful organizations without question. A doctorate level BCBA often has a little more expertise in clinical director roles. So that is something to consider. A large percentage of clinical teaching staff are BCBAs, right? So if you're working for an organization where there are many BCBAs, chances are that organization and you as an individual will be very successful in your job, for the simple reason that you have peer review. If you develop interventions or you're struggling with a case, you can turn to another BCBA to get some feedback or consultation. If you are the only BCBA or one of few BCBAs in the organization, success may be a little more challenging. So, for example, I've done some consultation work and I've worked for organizations where initially I was the only BCBA and I hired a couple additional BCBAs, but the what would be referred to as the operational staff far outnumbered the clinical staff. So in some of these organizations, you get this sort of power struggle, and I'm speaking sort of candidly or a little more casually here. You get a power struggle between what are referred to as operations staff, so the administration whose goal it is to make the organization financially successful, gets into a power struggle with the clinical staff, the staff who are there to serve the individuals and ensure that they are reaching their clinical goals. So at times the two camps don't always see eye to eye and maybe sort of functioning in silos. So if you are, again, in an organization where there are many BCBAs, you're probably going to have a much more easier time being successful than if you are one of a few BCBAs. If there's a multidisciplinary approach, you need to ensure that within the organization, BCBAs are valued as an equal member to other disciplines. And again, drawing on my own experiences, I've worked in a variety of settings, some of which BCBAs were sort of on equal footing with nursing staff, psychology staff, and so forth. Other organizations where it sort of took precedence, so for example, Kennedy Krieger, it is a interdisciplinary approach where there are multiple disciplines, but behavior analysis is sort of the leaders in a sense. I've worked in other settings where behavior analysts were not as valued because at the time we were not a licensed profession. In fact, obviously in New Jersey, we are still not licensed, but that is in the works. So we'll see what happens with that. But nevertheless, you may find in your career that other disciplines, for example, psychology or psychiatry, may not quite value your opinion as other behavior analysts would. So we find ourselves often having to prove our value. And of course, we have the results to do that. It's helpful if an organization has a continuous quality improvement model. Now, again, that is not something we talked about, and it's a little bit beyond the scope of this lecture. But what I will tell you is you want to ensure that the organization is taking data on their outcomes. So think about all we know about identifying targets, identifying goals and objectives, defining them operationally, and collecting data to evaluate our progress toward those goals. An organization needs to do the same thing at a much larger scale. So, and they should be responding to those data. And it could be data that range from the number of individuals successfully discharged from your services, the number of individuals transitioning to, we'll say, a typical school-based program, or moving to a less restrictive setting. I think that's a better way to put it. So, of all the individuals you serve, 80% of them move to less restrictive services. That would be a good measure of your effectiveness as an organization. But there are other measures as well. Staff satisfaction. Are staff injured on the job, right? You'd want to measure that. So I encourage you to think about that. If you were to even open your own services, you become a BCBA and you open your own in-home provider, what type of measures would you take to ensure that your organization is meeting goals and is successful? We should be applying the same knowledge regarding data analysis that we use for our participants, our clients, in our organization. What else is required for success? Certainly, you as a behavior analyst has to have the appropriate expertise. So you're working within your scope of practice. Now, as an entry-level behavior analyst, you probably don't have a lot of experiences. Your scope of practice may be very narrow. If you're accruing all your experience hours working with children with autism, you are lacking other areas of expertise. So it's important that you round out that scope of practice. You want to have expertise in functional analysis, functional assessment of problem behavior, treatment for problem behavior, skills development, skill acquisition, discrete trial. As a behavior analyst, we should try to round out our experience as much as possible early in our career, but also throughout our career. You want to be able to have the competency to systematically evaluate the effectiveness of interventions, obviously. And most importantly here, you need to understand how to work with other disciplines. And this, again, sort of speaks to scope of practice, because if you've accrued all your experience doing in-home services, chances are you're not interacting with other disciplines. In other settings, like school-based settings, clinic-based settings, or hospital-based settings, we have to learn to work with other disciplines. Speech and language therapy, psychiatry, psychology. And this is again where that struggle can sometimes be. Is the behavior analyst a valued member? Well, if you understand how to work with other disciplines, you will certainly be a valued member. So for example, working with psychiatry, if the psychiatrist wants to prescribe a new medication for a certain outcome, let's just say it is to reduce anxiety, how can we help them evaluate that medication? We could work with them to figure out how to define the observable behaviors associated with anxiety and develop a measure and start collecting data to help them evaluate their medication. I've done that in a number of settings, and oftentimes the psychiatrists are thankful when you're collecting those data. They are surprised when you're able to help them evaluate a medication. Because remember, working with a population that sometimes has difficulties communicating. And for psychiatry, to evaluate the effects of their medication, they often need to ask the client, well, how do you feel? Do you feel better? Certainly they could do observations, but those observations tend to be short, a couple minutes, whereas we can observe the client over long periods of time. So understanding how to work with other disciplines is essential. And if you're faced with a case that is beyond your expertise, you should refer. Or maybe it's not beyond your expertise, but you're working in a setting that does not allow for you to conduct a safe functional analysis. Then you should be referring the client to somebody who can conduct those functional analyses. So you have to have the appropriate expertise. You have to understand your scope of practice, and you have to understand how to work with other disciplines. But you also have to be a good advocate for the client, first and foremost, for yourself within the organization, and for the discipline of behavior analysis. And I say that part because I've certainly been faced with working for an organization that was not equipped to handle certain cases, but the operational staff would sort of try to strong arm the clinical staff into making do with what we had to serve the individual. And there are many times you would have to stand up to operations to say, we cannot serve this individual. So that can be tough to do. Okay, so getting into more of the article by Richard Fox, all of you should know the name Richard Fox. There are certainly behavior analysts who are renowned in the field, and he is one of them. He was a ABA program faculty at Penn State, an expert in the assessment and treatment problem behavior. He did a lot of other things. but he's certainly noted for the rapid method of toilet training, Azarn and Fox in 71. And this chapter includes some of his highlights and insights with respect to what we've been talking about. So, systems theory. I talked about that in the beginning of the lecture, that you should consider the organization within which you're working as a system. And systems theory would state that every system seeks to maintain a state of equilibrium, eliminate any noise, so to speak. We could think of this as more of a data-based system, right? If we're collecting data on the health of our organization, we want to have good health all the time. We want our system to be in a state of equilibrium. If there's noise, such as low staff morale, or we're serving more difficult clients and our outcomes are not as good, that is sort of noise and bad data, so we need to make sure we improve upon that. Well, if you consider some of the organizations that have been serving individuals with autism and developmental disabilities, they are old systems. Many of them have been around for years. If you think of some of the local ones, like, well, I won't name any organizations, but certainly a lot of organizations have been around here in New Jersey for many years. They are often resistant to change. We've talked about this at the individual level. If you're consulting to a classroom, the classroom staff may be resistant to change, but organizations can also be resistant to change. And as behavior analysts, we are often trying to change systems, not just change individuals, but change systems. Closed systems, those that are not open to outside influences, are very resistant to change and can eventually fail, right? Because the world is ever changing. As a practice, behavior analysis changes based on new research findings, and we should be adapting our practices to those new findings. So we need to be open to new things to change the system. So why do some programs fail? You could think of this as individual programs you're running or programs within a system. The reactive treatment model. There's nothing more frustrating than this. That is, you're not running planned interventions. You're reacting when an individual has problematic behavior. Or you develop the plan after weeks or months of the individual having a problem behavior. So it's always helpful to create a system if you're serving a large population of individuals, like a residential setting, that you have a baseline level of intervention. You want to be proactive. You should be setting up programs for individuals. Even if they have minor problem behaviors, there should be little programs, less intense programs to eliminate those mild problem behaviors. Certainly there should be programs for teaching skills. Okay, so we want to create a setting where behavioral principles are employed proactively instead of reactively. Another reason why a program may fail is because the system or the organization does not see ABA as relevant. I already talked about this, that the administration has to embrace behavior analysis in order for you to be successful. I would encourage you to look at some of the larger organizations serving individuals with autism and developmental disabilities and see where ABA is listed. Is it highlighted as something the organization employs broadly, or is it one of many things the organization employs? That I think would be an interesting exercise for you to do. We need to be valued as the other disciplines within the organization. So if the organization is run by a social worker, and they have social workers in the organization, maybe even developing support plans, how do they work with behavior analysts? Do they see it as a valued contribution, or is it something where there is sort of conflict in approach? And I would say that all staff within the organization should have a basic understanding of ABA. Think back to the sections we read on preschool systems or early intervention classrooms. All the staff should have some training in behavior analysis. That said, not every setting can provide effective programming. Certain settings may lack expertise serving individuals with severe behavior disorders, right? So you may be really good at developing skill acquisition programs for children with autism or adults with autism, but you may lack the expertise in the assessment and treatment of severe problem behaviors. Autism-specific programs may lack expertise applying ABA to other populations. So that again speaks to your scope of practice. Have you only worked with individuals with autism, or have you worked with other individuals as well? It's essentially unacceptable to continue running behavior programs that's not producing an outcome. And I've seen this in organizations where it's just you're running the same behavior program month after month, year after year, and there's no improvement. We can't do that. That's unacceptable. We have to be sure to produce positive outcomes. Now, that said, the failure of an individual behavior program is not always the fault of the behavior analyst. I would say you are responsible to try to bring about the change, but that may entail not just ensuring the integrity of the program, but ensuring that the staff are running the program well, that operations staff are supporting the program. And again, it cycles back to the organization supporting behavior analysis. There are some settings that view reinforcement as unnatural, stating that reinforcement undermines intrinsic motivation. Some of you may have heard this idea. Some of you, probably in classroom settings, have heard this. This idea is based on flawed studies. It doesn't hold up in the face of well-controlled research. Reinforcement does not undermine intrinsic motivation. Some folks may be objectionable to food as reinforcers. Why is that? We need to ask these questions. Our job as behavior analysts is to identify preferred stimuli that function as reinforcers. If those items happen to be food items, and those are the only things that are reinforcing, I'm going to use them as a behavior analyst. So we want to be able to demonstrate the benefits of reinforcement, conduct preference assessments, identify reinforcers, collect data when contingent reinforcement is in place to show that we make significant gains when we're using reinforcement. Systems skill level. We want to ensure that the system is set up in a way that can produce successful outcomes with less severe behavior. So again, we could think of this as different levels where there is an overreaching sort of behavior program that all the individuals participate in. If you're serving a large group of individuals, maybe they all participate in a token economy. Maybe all staff are trained to provide positive reinforcement in some way. Then, if there are some individuals that need more support, more behavior support, then you're developing individualized behavior support plans. So you want to try to set that up, that you have a program that is thoroughly based on behavior analysis, and you could see the behavior analytic principles applied at every level of the organization. You don't want to fall into the trap of putting out fires, right? You want to be proactive as stated. So any of the systems we could put into place, we should be putting them into place. And again, I'll sort of step out of the focus on serving individuals and looking at the organization as a whole. So you don't want to put out a fire where the staff are disgruntled employees. You don't want to be in a position to have to change or improve staff morale. You want to create a system where staff morale is generally always good, right? So we could set this up through behavior analytic principles. Speaking with respect to individual cases, you want to take the time necessary to thoroughly assess and treat the most severe problem cases. If you're working in an organization that serves many individuals, I think the biggest impact could come with serving the most severe individuals first, right? So imagine yourself being a new behavior analyst working for a residential service agency. Maybe there's one other behavior analyst there, and you're charged with developing support plans for 10 individuals. Prioritize the one or two that are most severe and focus all your energy there, change that behavior, and at that point you will get buy-in from all the staff in the organization as well as the organization. So address those most severe cases first. Don't let the administration dictate practice. You are the professional, you are the behavior analyst. You want to work with them, but they can't tell you who you can and cannot serve, right? That is our ethics. We have to stand by our ethics. So if we cannot safely serve an individual, we need to refer them. And as I mentioned, that could be a challenge. Okay, another reason why behavior programs may fail is because the recipe approach has been used. Now, all of you have been trained to do thorough assessments and develop function-based interventions, so this will hopefully never be associated with your practice. That said, there are organizations currently and in the past that have used sort of the recipe approach. In fact, for many of the residential services here in New Jersey, the qualifications for developing behavior support plans was not a BCBA. In fact, it still may not be a BCBA. I haven't looked in a couple months. It was a high school diploma or a bachelor's degree with some experience writing behavior plans. And many of those plans tend to be more strategy-based as opposed to function-based interventions. So you may find yourself at one point in your career looking over a behavior support plan that is more strategies. They used a recipe that token economies tend to work, so we employ it. We need to move away from that, right? We need to conduct thorough assessments, develop function-based interventions that are simple, that don't include all these additional strategies that may not even be necessary. Evidence-based practice is certainly important and very important to the success of any intervention. I like to again extrapolate this to the larger organizational system. The whole organization needs to be founded in evidence-based practices. Many a times, if we're working at an organization where there are multiple disciplines, some of those disciplines may employ practices for which there's little to no evidence. Sensory diet, for example. So if we're in this position, obviously everything we do will be evidence-based. It needs to be. That is our code of ethics. So our behavior programs should only employ evidence-based strategies. Now, if the individual that you're working with occasionally goes to see the OT, that is outside our domain. However, I would tactfully and carefully navigate working collaboratively within the organization to ensure that there's some data collected on the effectiveness of the interventions to establish whether or not there's some evidence. So again, this is speaking sort of broadly, working within an organization. You want to advocate not only for you as a behavior analyst in the field of behavior analysis, but evidence-based practices in general. And you need to navigate that carefully if there's other professionals within the organization. As mentioned before, the biggest aspect of a successful program is support from administration. There needs to be behavior analysts in administrative positions to advocate for the practice of behavior analysis within the organization, as well as each individual BCBA or RBT within the organization. And I would say all staff within the organization should have some basic training on behavior analytic procedures, particularly those working with clients, but it might be helpful to do a basic behavior analysis training for the senior administrators. Maybe they know they have to offer ABA services, but they really don't know anything about it. So I think it could go a long way by teaching administrators something about behavior analysis, more importantly, the successes of behavior analysis. So support from administration, particularly important. And that is the end. This is, I think it's a good chapter. It is more focused on individual behavior support programs for individuals with severe behavior disorders. But as I mentioned, I think it's useful to sort of extrapolate each of these areas that are discussed into consideration for larger systems within which we work.